Hey, this is Dr. Jason Dean with Palmer Natural Health, and I'm coming to you because I had a patient come in yesterday with a very specific problem, and most people don't know how to actually handle this issue, and I'm going to actually play it out for you right now, kind of a story. So a person comes in, and they're actually a CrossFit individual. So CrossFit is an exercise routine. It's weightlifting, a whole bunch of different things put together. Now, he was in CrossFit, but I will tell you most of the public is actually dealing with this issue, and they don't even know it, whether they're in CrossFit or exercising or not. And I want to tell you about it. It's low back issues, even potentially herniated discs. So let me get a spine to show you what's actually happening. So this is your spine, okay? We have nerves coming out. We have discs right in here and vertebrae. And then if I turn this around, there's a model here. There's a little red piece sticking out here. That is a herniated disc or a model of herniated disc. Now, most of you are having herniated disc because we might be being too strenuous. We have a very sedentary lifestyle where we actually sit in a chair in an office all day at a computer and we're not moving around enough. You can get it from over physical exertion as well. So there's two things you have to do. One, you actually have to get the spine adjusted so that herniation can pull itself back in. Also some cool things with our table here where we can actually help that disc come back in. But the other thing is, most people think that discs can't be healed over a period of time. Well, they actually can. There is blood flow to those areas, even though it's minimal, and you have to get proper nutrition to those areas. Now, how do we get proper nutrition to the areas? Your spine moves back and forth. The joints separate as you move. Remember I said we have a sedentary lifestyle today? Well, if you're up and moving, walking, running, exercising, you get the spine actually moving back and forth. When that does that, you actually create kind of a pump action where nutrition goes into the area and actually can make a disc regenerate itself. So I have a couple things up here. Now, glucosamine is the supplement we use. You may have heard of that in the news, the public, Dr. Oz maybe. Glucosamine is actually really great for disc and cartilage use in joints. Remember, your vertebrae and your spine are joints. Now, another thing we have here is we have ligaplex 1 and 2, okay? Little weird names. Liga for ligaments. Ligaplex 1 is for acute or very sudden right now injuries. Ligaplex 2 is actually for long-term chronic injuries that people have. This all can help out the spine. This is what we do. Now, if I have to go even farther, I actually have a supplement here called ARDA. It's an herbal formula. In our office, we only use whole food. We use herbal, homeopathic products, as well as some stem cell products, okay? So when we use these, what's actually happening is, you can't just get these anywhere. You can't go to your local health food store and get these. They're physician grade only because they're very powerful, they're high end, and they work really well. This one is actually for joint specific. It's an herbal joint specific formula that actually helps the joints quite a bit. A combination of this joint as well as chiropractic care is going to handle that herniated or bulging disc and help the body actually heal itself. And then, worst case scenario, if you really have a major problem, we can go to regenerative therapy, which is basically extractions of stem cells that people can take, and long term, you're going to actually help the body heal. The body knows how to heal. The spine knows how to heal. The spine takes a little longer sometimes than regular organs, but the body and the spine know how to heal itself. It just needs the proper ingredients, not synthetic chemicals or synthetic supplements. Like, for example, when you see vitamin C, and you look on the back and it says vitamin C is ascorbic acid. Well, vitamin C really isn't ascorbic acid. Vitamin C is a whole complex. That's why we use whole food here. We use herbal here, also a form of whole food, and then stem cell if necessary to actually heal that body. So the spine actually works really well when you give it the proper building blocks for life. And that's how we actually build the body up, okay? So I just want to show you whole food nutrition, herbal nutrition, homeopathic nutrition. Dr. Palmer is coming into the picture here to say hi. Tell her hi. But that's how we handle spinal issues here. So that person that came in yesterday that had a spinal issue, they literally, as they walked, they were in pain. And when they bent over, they didn't have pain anymore. They had herniated discs in their low back. This is how we actually help you with those herniations or bulging discs, but also not just at getting adjusted back into a place to get the pain to go away, but you have to have proper nutrition to get the spine as well as any other organ in the body healing. So this is Dr. Jason Dean with Palmer Natural Health. This is how you help handle spinal issues. This is how you help handle any organ issue and how you get the body healing again, because the body is brilliant. The body knows how to heal. We just have to put it in proper alignment with the spine and get proper nutrition in the body so the building blocks can be put back to the body. Again, Dr. Jason Dean, Palmer Natural Health. We'll talk to you soon. If you have anybody out there who you know needs our help, 407-682-8444 or go to palmernaturalhealth.com. We'll talk to you guys soon. Have a great day.